Joining us now is Senator Tom Cotton from Washington, D.C. Senator, as always, good to be with you. Thanks for being with us today.
Hey, Roby, good to be with you too.
Let's begin with this whole repeal now, replace later approach to healthcare reform. You said on Tuesday that you supported that approach to healthcare reform, which seems to be a path that is being considered right now. You voted for a measure in 2015. However, in January of this year, you told Meet the Press that you need to have a solution in place before anybody would move forward. How do you square those two statements?
Well, Roby, repealing Obamacare and working on a replacement over a 2-year period isn't the best solution. It seemed earlier this week like that was the most practical solution given where we were. In January, frankly, I had a hard time imagining that so many Republican senators who had campaigned on repealing and replacing Obamacare wouldn't be so enthusiastic to doing so when it got down to brass tacks. However, I can tell all of your viewers that we had a very productive and constructive lunch with President Trump at the White House today. And we're still going to be working on negotiating a replacement bill right now that we can vote on next week. I hope that we can get to a solution that's going to make health care a little bit better and a little bit more affordable for Arkansans. That's what we're going to be working on over the next few days.
Is this measure that you and the president talked about today at lunch, is this going to have some new details in it that we haven't heard before? And will it be a Republican kind of leaning type vote in terms of you haven't had any Democratic input on this?
No, Roby, unfortunately, we still don't have any cooperation from the Democrats on this health care measure, even though Obamacare is hurting their states just as much as it's hurting Republican states. So we're going to continue to try to find 50 Republican votes. We'll start with the measure that we're under consideration until Monday night. Try to tweak it in various ways to make sure that those people who need a little bit extra financial assistance can get it to pay for their premiums or pay for their deductibles. Maybe also change the Obamacare regulations so Arkansans will have more choice in the kind of insurance plan that they and their family need, so they can buy plans that suit those needs as opposed to have a one-size-fits-all plan dictated by Obamacare. Again, I don't know if we'll be able to find a path forward to get to 50 votes, but I think we should certainly keep working on it, and I'm glad that President Trump asked us to do that, and there's a renewed commitment in the Republican caucus to do so.
And you said that you think that there will be some tweaks coming between now and possibly next Monday when a vote on this might occur. Is there something specific you will be advocating for in terms of a tweak that would be beneficial to Arkansas from where things stand today?
Well, Roby, I certainly think that we should move forward with more consumer choice. That's an amendment that Ted Cruz and Mike Lee have proposed to the measure. A version of it was incorporated. We're frankly still waiting for some more information from the Department of Health and Human Services about what that will do to enrollment in insurance plans and premiums. But from the preliminary data, it looks pretty good, that over time, you'll see premiums declining pretty significantly. I'm also interested in seeing what the Secretary of HHS and the Administrator of the Center for Medicare and Medicaid Services can do to help those people who need a little more financial assistance, who may be coming off Medicaid, as we'll have in Arkansas about 60,000 people coming off Medicaid soon, get that assistance. That's the kind of model that some of the senators want to see, and actually they're looking to Arkansas, and what Governor Hutchinson and our legislature has done is kind of a model.
Governor Hutchinson and you have had a lot of conversations, at least according to Governor Hutchinson. He says that that is the case, and I believe him when he says that. And one of the things that he says he has advocated to you and to Senator Bozeman is that any cuts to Medicaid could be detrimental to Arkansas. By one estimate, he said it could be blow a $500 million hole in Arkansas state budget. Are you, I guess, of the opinion, and are you fighting for the position of no cuts to Medicaid as it would affect Arkansas?
Roby, Governor Hutchinson and I have consulted on many occasions over the last several months. I know he's done the same thing with John Bozeman, and I appreciate his constructive approach to this as well. He knows that Obamacare is failing too. This legislation will not have any cuts to Medicaid. In every single year, Medicaid spending would continue to increase. We would also change Medicaid into a kind of block grant program, just like Bill Clinton and Republicans did to welfare in the 1990s, to give our state government more flexibility, more authority to craft solutions that work for Arkansas. That's going to start in the hands of Governor Hutchinson and this legislature, but it's going to pass through many more hands over the next 10 years because that's the timeline of the solution we're trying to craft, a solution that's going to last for the long term, fix the problems with our healthcare system that predated Obamacare, but also fix the problems that Obamacare either made worse or created.
Some have said, including the governor, that as it stands right now in terms of the GOP plans that have been out there, that the slowdown to Medicaid growth and the shift to the states to control some of this Medicaid spending is going to be a negative for the state of Arkansas, that it is going to not fill the gap, not fill the hole. But I hear you saying that it's going to be the reverse of that. So who are we to believe?
Well, Roby, I think the future model of healthcare under this legislation would certainly be different than what it's been under Obamacare, with rising premium rates and higher deductibles, but it might be received in a different way. For instance, a couple months ago, our legislature and the governor moved about 60,000 Arkansans off of Arkansas Works, the expanded Medicaid program, and into the health insurance exchanges. That might be an option for Arkansas or many other states. Currently today, if a state hasn't expanded its Medicaid program, people who live at or below the poverty level have no option whatsoever because tax credits aren't available to buy insurance on the private market. Under this legislation, tax credits would be available. And as I mentioned, one of the points that will be under negotiation in the coming days, providing a little bit of extra financial assistance to those who might need it to supplement those tax credits to pay for their health insurance premiums or their deductibles. So the way health insurance is delivered may change, but I'm committed to making sure that all Arkansans have access to health insurance.
Let me ask you another question too. President Trump has said that he is considering cutting off the subsidy funding to the health insurance exchanges as a way to speed up the decline of Obamacare. Do you advocate that position? Is that something the president should do, and do you support that approach?
Well, Roby, the president's hands may be tied on this matter. The House of Representatives has a lawsuit ongoing that started in the Obama era, continues to this day, on the grounds that those payments to insurance companies weren't authorized under the text of Obamacare. Our legislation, recognizing that Obamacare has caused a lot of damage to the insurance markets, would give the administration legal basis to continue them in the short term, so we make sure that the insurance markets aren't destabilized. That's just another reason why I think the best approach is to try to repeal and replace Obamacare right now at the same time. And I hope that's what we can do over the coming days and the next couple weeks. If not, though, like I said, the best practical approach, given where we are, may be to repeal and ultimately try to find consensus around a solution, and hopefully with some Democratic votes over the next 2 years. We'll just have to see how things play out in the negotiations.
Last question on healthcare. If the president does decide to cut those subsidies off, would you voice opposition to that?
Roby, I'd have to see what the president's decision is in terms of timeline. On the one hand, I don't want to see the rug pulled out from Arkansans who are complying with Obamacare regulations, harmful though they may be. But on the other hand, the president has to comply with the law as well. And if a court order tells him that he can't pay those, or the Department of Justice has concluded that he can't pay those subsidies, then he has to comply with that decision.
All right, Senator Tom Cotton, we appreciate your time. Thank you for being with us.
Thank you, Robbie.